introductions. So I'll start with me. I'm Travis Hallman, like transportation part of MAPA.
Melanie Davis from Mineral Miner Institute, the vice chair of CTC.
Haley Stanley, City of La Vista.
John Owens, paratransit manager for Metro.
Tammy Bradley, Transportation, Florence Home.
Charlie Harrington, MAPA.
Gord Barber, MAPA.
Laura Heineman, Napa.
Brandon Smith, Lamar Public Schools.
Alicia Johnson, Metro.
Carlos Morales, MAPA.
Annie Jensen, City of Kansas Bluffs.
Rich Sturber, Division of Family Services.
Randy Stoney, Eastern Nebraska Human Service Agency.
I'm Nat Zimmerman, I'm ADP for the United Way of the Midlands.
And I'm Steve Rippey with United Way of the Midlands.
Jane Burton, Blackfield Works. So the only thing that is an action item on our agenda is to approve the meeting minutes from July 19. Can I get a motion?
I approve.
Second? Second. Moving on to the first discussion.
All in favor? All in favor, say aye.
Aye.
Any opposed? Motion passes.
We move on to the first discussion item, the United Way discussion.
So we have, as Steve just introduced himself, he's with United Way and 211. We've requested that they provide an agency update to us for this committee. United Way provides just a ton of resources for a lot of the target populations of this committee. So we are very excited to have them here to present kind of what they do for all of the people we serve here in the region. So take it away.
Awesome. Good morning, everyone. My name is Steve Rippey. I am the Senior Director for the 211 Helpline. And I appreciate giving me something that you don't have much of anymore. Is that your time? So I appreciate giving the opportunity to discuss 211. Is everyone familiar with what 211 is? To give you a high level to low. So 211 is a national federally subsidized program. And it was set up by the FCC. So it's like 911, 411, 611. You can call 211 for human services, resources, whatever it is. So there's 300 211s in the United States. And it's not tied to nonprofits. So there's some for-profit 211s. Los Angeles itself in the city has 9 211s. So you could go from neighborhood to neighborhood and get connected with a separate 211. So it's a little bit crazy. In the state of Nebraska, we're fortunate that we have just one. So we are powered by the United Way of the Midlands, but we are Nebraska 211. We cover the entire state, all 93 counties. And on July 1st, we took over the entire state of Iowa as well. So we, except for 5 counties in Northeast Iowa, which belong to Gunderson Health in Wisconsin. So we have 187 counties that we cover out of Omaha. It is, so whoever takes on the 211, United Way took it on for the state of Nebraska. They're responsible for it, right? They have to pay the payroll and all that stuff. We are fortunate for the state of Nebraska that we have programs that fund our programs. So instead of taking United Way dollars and paying for 211, we have programs that pay for our payroll and that type of thing. So we are almost fully funded outside of the United Way. So all the money that's going into the United Way actually could go back into the community. So we're really proud of that. We operate 24/7, 365. We cover 240 languages. Over half of our staff are bilingual in Spanish, and so that's we're proud of that as well. So we're not sending that to a translation service, we're helping them one-on-one. Like I said, we're part of the 211 network. You can call us, you could send a text message, you can email, you can chat online, or you could actually go into a mobile app and get your resources there. So you don't have to call 211. My team laughs at me when I say this, but I always say 211 is the 411 before you have to call 911. Right? So we want to make sure that if you're struggling, you have the ability to call us. And we can help you with resources, right? We can't fix your problem, but we can give you resources in the community that can. Last fiscal year, our fiscal year runs July 1st through the end of June. We handled 313,080 total contacts in the fiscal year. That also includes web hits. So if someone went to our website to look for resources, it includes those as well. Our analytics team did a community resource survey this summer. And we discovered that 90% of our callers could not afford a $400 emergency expense. So if they had an emergency expense in the year or in the month that was $400, they would not be able to afford that. The national average is 25%. So it kind of tells you about the needs in Omaha are much greater than at the national level. We have a robust database with 4,000 different agencies. 23,000 different resources, because some agencies have multiple resources. We are accredited through Inform USA as an information referral service. It used to be called AIRS, so you guys may have heard of AIRS accreditation. They just recently changed their name to Inform USA. And then we have unique partnerships to support social determinants of health, other unique needs, circumstances. We have Unite Nebraska and Help Me Grow. We are the administrators for Goodfellows. Have you guys heard of Goodfellows? It actually started with the Omaha World Herald, and we are now the administrator of that. So people, it's $1,000 max, but at any time someone could call in and apply for Goodfellows and get up to $1,000 maximum. So they could get 4 $250 donations, or they could get 1,000. So if they needed rent or utilities, they could contact us and we could give them that money if they qualify. We also do Dollar Energy, which is MUD and OPPD, Pennies for Power, which is MPD. So we provide financial assistance for those programs. We have a program that's called Ride United, which gives us the ability to give free lift rides to people in the Omaha Metro, Douglas, Sarpy, Potawatomi County. And we have selected employment, health, and legal. So if they need a ride to work because their car broke down, we could set them up with a lift ride. I was telling Travis earlier, this year at Ride United, we lost 2/3 of what we were giving on an annual basis. And so it's really gone down. So we're looking for other opportunities that we could help the community get free rides. If that's bus passes or whatever that is, to help the community. We also on July 1st became an ADRC. So we are an ADRC in the state of Nebraska. Aging and Disability Resource Center. And with the ADRC, we are also going to become a VOCA, which is Victims of Crime Act. And what we decided to do is it's a program called Save Our Seniors. So elder abuse, scams, or whatever, they could call us and we'll walk them through the process. If you guys have any questions at all, let me know. Just talking away here. Here's the different circles of support that we have. You get resources from arts, culture and recreation, clothing, disaster services, utilities, transportation, mental health, employment, food, housing, all that stuff. I don't need to go through all of them, but you can see everything that we cover. There we go. So this is kind of 2-in-1, how it works, right? So a community member experiences a need. They reach out to 2-in-1 by a simple number called 2-in-1. Our specialist answers the call 24/7, 365. We're gonna ask them very first question we're gonna ask is, what is your zip code? That's gonna tell us if it's Iowa, if it's Nebraska, if it's Douglas County, or if it's an outstate county or whatever it is, because the resources in the county is going to depend upon what they are eligible for and have access to. So 211 is an open source, what we consider an open source referral. So we're just going to give resources. So we're going to say, you need a food pantry. Here's 3 food pantries that are in your zip code that are close to you. And we could text that information to them or give it over the phone, and then we're done with them. And I don't mean that negatively, but we just go to the next call then. If it's somebody we feel that needs to be followed up on, like I haven't had food in 4 weeks, here's a food pantry for you, but we're also going to follow up with you in a couple days to make sure you got that food. So we do follow-ups with that. But yeah, so they contact the resource, and then the community organization provides the services. The Unite Nebraska and Help Me Grow, those are considered closed loop. So we get a referral from a doctor. What Unite Nebraska is you go to the doctor and they ask those questions at the beginning, right? Do you feel safe? Do you have access to food? Do you have permanent housing? Those questions. If they say, no, I don't have access to food, they put it in their system. That system sends us a referral. And then when you get home, we give you a call to say, hey, Dr. Jackson, send us your name, said that you don't have access to food. Here's a couple of food pantries that are in your area. We then follow up to make sure they went and got food, and then we put it back in the system. So the next time you see Dr. Jackson, he's going to say, I see that you went to Park Ministries and got food. Does that make sense? So that's the difference between the open loop and the closed loop. So top reasons why people utilize the 211 helpline. And these, you're going to see transportation is only 6%, but remember we had 313,000 contacts. So it's a conservative number when you think about the individuals that need the help. Housing obviously is the top one. It's always going to be there. I think we all know that Omaha is struggling with affordable housing. Utility assistance is next. Income support is third. Income support also includes taxes. And we take free tax appointments during tax season. So that's why that's a higher number when you look at the entire year. Transportation and then food and meals is the bottom of the top 5. We provided over 130,000 referrals during the fiscal year for the state of Nebraska. We took calls from 89 of the 93 counties in Nebraska. So there were only 3 counties that did not utilize 211. And it's not that they didn't want to utilize 211, it's just those are the lower populated counties that didn't have a need apparently. We have partnerships provide direct rental and utility assistance. And then again, the programs that we offer. So here's, again, we have an analysis team that does a lot of, let me step back. So when we take a call, it's confidential, but we do take demographics and we have an assessment at the beginning. Because we have that assessment, we're able to do a lot of great reporting. And like I was talking with Travis earlier, like it'd be great if we could partner as a community and share all of the data that we have, and we would have some really cool data to be able to present. But we know here in the metro, 1,400 people are homeless on any given night. 1 in 3 people in the metro have experienced symptoms of chronic depression. Childcare issues keep 13.5% of employees in Nebraska and 12.8% of employees in Iowa from going to work each year. 50,000 pay too much in rent. And our community is, we know this is 80,000 units short of affordable housing needs. At all income levels, fewer people say they have someone to turn to, and the number of disconnected youth has increased from 8,900 to approximately 12,000. So lots of needs in the community. We hear it every day. But the good news is that we're making a difference every day. No matter how slow it is, or incremental, we're making those changes, so. Transportation is the top 5 need for 211 callers. We know that 4,896 transportation needs, 930 unmet needs, so over 5,000 total transportation needs. We were able to give 81% of the people calling in at least one resource for a referral, if that was the Lyft program, the bus, for the ADRC, the vans, or whatever it is. 14% of all 211 unmet needs were for transportation. It's had the second highest number of total unmet needs. Like I said, we just took over the state of Iowa, except for the 5 counties in Northeast Iowa. Iowa has been interesting for us because there was no outreach in Iowa. Iowa's a much larger population than Nebraska, but we take about 50% less calls in Iowa than we do in Nebraska, just because there hasn't been the outreach there. So our goal this year is to get out there and really push for 211 and to start partnering with some different organizations. We talk about working poor. Des Moines has the second highest working poor in the top 100 metro areas, and Omaha Council Bluffs is the 4th highest. Then we talk about the senior population. This senior population actually has taken over the highest poverty, and we know that there's going to be an increase of 51% between 2020 and 2045 for the senior population. And so that's why we became an ADRC and want to partner with the different organizations to help the senior population. 9% of 211 callers made up of the 65 or older. 70% of senior callers to 211 are between 65 and 75. And then we have the ethnicity and the top needs you can see change. So housing isn't the top needs for the senior population, and transportation was at 5%. I know that was really a high level overview, but we're super excited to be able to partner with everybody, with MAPA, to figure out how we can help better the community and improve the transportation needs in their home. Any questions?
I have a comment and a question. 211's been around for a long time, and I see you really enhanced it a lot. And that's your credit. You guys have really worked hard on it. So one of the things that I've found over the years and trying to help people that have problems is our social safety net, and that's government and not-for-profits and churches and folks like that. What happens a lot is people are referred somewhere, and then they find out, well, they're not eligible, and for good reason a lot of times.
Yep.
And then they go somewhere else, they go somewhere else, they go somewhere else. What I think all of us should focus more on is, of the people that were interested in your program or sought help, what percent ever actually received help? And I think you talked a little bit about follow-up, which obviously you can't follow up on every single one, but it seems like it would be possible to do a sampling, because it's really tells us something about the effectiveness and the health of our local safety for folks.
Yeah, so like in a perfect world for us is that there would be a system that everybody would use, right? Like I don't know, we'll just call it the Silver Monkey system. And that system would be that every agency was on that system. And so if Annette called in to 211 to say that I needed a food pantry in my area, that we would enter it into the system and we would say, go to Heart Ministry, they're in your neighborhood, they can help you. And then Heart Ministry would see that we referred Annette, and then Annette would show up at Heart Ministries and they would click her as, yes, she showed up. And then we would have this closed loop to be able to see, we referred her, did she go get the help? Did she get the food, right? Like, that's the ideal world. The problem is that would be a super expensive program, and to get every agency to be able to use that program, we know it's nearly impossible, right? So, so how we can do it is we do the follow-ups, and we do know that I think it's 78% of the people are telling us that they went and got the help for the resources that we gave them. Now, did they get the food, or did they go to the food pantry, but they didn't like the food there? We don't know that. But we do know that 78% of the people that we give resources to, based off of the follow-up conversations, the sampling, are getting the help.
Yeah,
So,
sounds like a good start.
yeah. So, but the only way to really get to the point of, are people getting the help that they need, is really hard.
If you just simply followed up with a sample
Yeah.
of the people that called in,
Yeah.
it would be self-report.
Yes, yep,
But it would, you know, it would tell us something about where the problem solved, and also just how satisfied the people were by all of these things. Ease to access, how they were treated, and all those things.
Yep.
It kind of capture that and give us a little information about how we're doing.
yep, absolutely. Yep, good point. Anybody else? Questions?
I'll take a shot.
Yeah.
So some of the things, going through the slides, transportation is a very large and evolving need. And totally understand where you're coming from, but are there additional information points? Is it the access to transportation services that people are calling in for? You mentioned there was like 930 unmet needs. Is it just, there's no transportation service where I live? Help, is that more of the call, or is it the call about, I can't afford the services that are currently provided for me, can help, or in order to reach transit, I need to walk or get to a sidewalk that doesn't currently exist? Please help.
Yeah,
Like,
no,
I want to start
yeah,
getting
well,
into some of those threads and trying to understand how we might be able to help.
that's actually a great point. So we are trying to change the way that we ask questions, right? So right now, Annette calls in to say, hey, I don't have access to food. And we say, what is your zip code? And we give her food things, right? We don't go down the path of, why don't you have access to food? Is it transportation, right? So when we talk about transportation being only at 6%, it's probably more like 75%. It's just that the people aren't telling us that that's the reason why they can't pay rent, or they can't work, or they can't pay their utilities. It could be, I mean, as you guys know, it's definitely related to transportation, right? I mean, if you don't have transportation, you can't get to work. And if you can't get to work, you can't pay your bills. And if you can't pay your bills, you can't feed your family. And so we want to start digging down that wormhole of like, what is the root cause of your issues? Because maybe it's not that you need food. But if you need transportation, if we could fix that or help you with that, it may fix food, utilities, and that type of thing. So that is on our radar of how do we get more information like that. We don't want to come across as, I'm going to ask you about 15 minutes worth of questions before I tell you where the food pantry is, right? Because these people are calling, wanting food, but we also need that information, to your point, to be able to assist them better.
And just be better able to communicate and share, and we've talked,
Yep,
just for the group to understand, we talked, with 211, and this is a valuable opportunity to start sharing information and start, building this wonderful partnership. I mean, the expanse of what you guys are serving is just tremendous.
Yeah.
amount of money.
Yeah.
I'm barely trying to hold on to the TMA here. You know, but I think it's a good opportunity for us to also organize as this group, as we have certain transportation providers. That specialize in providing paratransit services for the elderly.
yep,
And people that lack full mobility access. And so if we can share additional information or having that communication to be able to share the resources that are available in this room. And then two, from the 2.1 side, like how do we share or create that feedback loop about needs assessments, right? Where are we deficient in terms of providing services, or is there a concentration we need to start focusing on, like zip code, whatever,
yeah,
is trying to get to downtown Omaha, but they're complaining there's no services, right? So that we can start matching origin destination fields and services that might be available in the area.
yeah, absolutely. And I know we have like La Vista and Council Bluffs in here, like, if we get information from those community members, you guys may already know that in La Vista, but maybe we have some information too that we're hearing from people about transportation issues or whatever it is in the 68128 zip code, right? So. And then I know we have OPF in here. We also partner with the JAG program and you know, talking about students and how they're getting to school or having those transportation issues as well. So like we have all this information, this big data that we should be sharing and you know, as a community, that's the only way that we're going to come together and fix the issues.
I know I work for the city of Bellevue, and so the transportation is only maybe half of what my job is. The other portion is homeless prevention, hardship assistance, medical assistance, things like that. So 211 refers to me often. And I think at least in Sarpy County, what we find is we utilize you guys just for that, the referral source. And then once they get to us, we go far deeper into that case management type piece. So, I mean, I think it might be beneficial if you go a little bit further, but just know that wherever you're sending people, most agencies ask those deeper questions, get a little bit more of the story and kind of.
And the good news is we have built that trust with the agencies that we work with, so we feel confident that if I pass somebody on to you, that you're going to.
We got it from there. Yeah, and I think that there's something also too, where a lot of these families that are in need and struggling, there's I mean, I think they're already stressed out and there's some shame and embarrassment there, and they just don't want to tell their story several times. So maybe to call, get that quick referral, and then be able to sit down with somebody face to face and really just unload everything is beneficial too, so they don't feel like they're just repeating themselves. So I do like that relationship with 211 and the fact that they can get what they need quick and move forward because they are stressed and oftentimes desperate.
Yeah. My wife is in charge of the staffing on the base. She tells me all the time, there's no buses that run out to the base. And because of that, they don't get employment. They're losing.
Yeah, we're a dead zone for sure. Yeah, it's super frustrating.
And I think one last nugget of information is, there's a difference between passive information sharing, right? Like a lot of our agencies change their hours of service or might change their fees for their services on the routes that they're using, or conditions to receive a discounted fare. And they will do a good job at posting it on their website. But then how do we ensure that's in 211 and vice versa, that the information as a resource, as a referral agency is getting to 211 correctly? Who do they refer to at the cities or the localities, because it changes from year to year sometimes. Sometimes they change it quarterly, that's what Metro often does. And so how do we change it from a passive to a more active implementation of information sharing?
Yeah, no, and that's a great point, and I think ERAP really, the Emergency Rental Assistance Program really blew up with a gap there. And, you know, when we talk about life is super complicated for a lot of people, and we try to make it less complicated. But if agency A is no longer taking applications for ERAP, and we say they are, then we're sending somebody, we're making it more complicated. Now they're calling somebody and saying, oh, we're not taking them. So we need to figure out how can we open up that. And with technology, I mean, we are in 2023 now, right? So we should have the ability to instantly update when you're no longer taking applications or you're no longer supporting program A or whatever.
Right, and most recently, within our region, within our area, NOAA is no longer providing transit service. And that's impacted some of the counties outside our MPL region. And has caused a little like heartburn with a lot of people and really destroyed some of these kind of routes that were serving medical services. And so it became a very we're still trying to find out a better solution, but it's just an example. We heard it here, they came here and they said, yeah, we're no longer gonna focus on transportation, but I don't know how that communicated to other services or other things.
And now I'm thinking I need to go back and check that database. But again, it's a perfect example of how we all just need to partner together and figure out how we're all sharing the same message and
Any other questions? We have them here. I was telling Steve when he got in here that when we were doing the coordinated transit plan update, I think most of the solutions was talk to 211. So this was obviously a real big step and us kind of starting to advance some of the goals that we've had in this process. So thank you very much for being here.
Absolutely. And it's just the beginning, right? Like we need to continue on this and we're going to get somebody to be on the committee and to be able to make some changes. Awesome. Thank you very much. Yeah, that's great. Thank you very much.
So back in August, by the way, this is Alicia Johnson, she's the DEI coordinator for Metro Transit. Back in August, we hosted the NADTC Symposium, which National Aging and Disability Transportation Center. So the symposium on diversity, equity, and inclusion. It included a presentation recorded by Tamika Butler, who's an Omaha native who works kind of in the DEI realm in Los Angeles. And we had about 22 members attend the event at the Revive Center in Omaha, including many of you in the room here. So obviously, we're very appreciative of your participation. What we're going to do here today is kind of just provide a very brief overview of kind of the barriers, solutions, and the kind of next steps we have. If you guys can see, I have an item here. I provide a matrix, just kind of the goals, the barriers, and the solutions. Here, so you guys can kind of take that home and read. A lot of it does read like a coordinated transit plan, and there are some things that are kind of more of an update to that plan. But this really did kind of serve as a quite incredible guiding event for us, kind of in the work that we're doing moving forward.
So there are many barriers that were identified, and this is a really great starting point for kind of gathering that and then also identifying some solutions. So some of the barriers that were discussed included the segregation and isolation of marginalized communities, particularly those around like affordable housing and accessing transit services. We know that there's barriers around geographic areas that are not currently served by transit and the 3/4 mile area around the transit lines for paratransit services. Language barriers, particularly for refugee populations. Not having a lot of resources for translation, especially beyond Spanish. We also had barriers for persons with sensory or neurological disabilities, so really thinking about the diversity within disabled populations. And then the stigma that continues, not just here in Omaha, but nationally, around public transportation, poverty and race, and some of those assumptions that are kind of placed on riders.
So I'm not gonna go through every item on the matrix that I provided you, because it was obviously a very robust conversation with a ton of solutions, and it really was a fantastic conversation with a lot of kind of action steps moving forward. A lot of the work that we did was split into 5 goals of accessibility, communication, coordination, education, and funding. When it comes to education, I think a lot of it was just, we need more people who can serve in community navigator roles, just people who can help people understand all the systems, because a lot of times, not one system, not one service can help a particular person access everything they need in the community. Having someone like that to kind of guide them through the system. Signage on buses and bus stops, I thought that was a real interesting bit of feedback. Just that's something that Metro Transit luckily is working on, but there was a lot of feedback on those, especially when it comes to how to serve certain populations who may not be able to see things or hear things properly, how to provide different information to get to different people in the best way fit for them. And then sidewalk inventory and build out. There's a lot of people who can ride transit if the sidewalks work, but unfortunately, there's a lot of parts of our community where sidewalks are either in such disrepair or non-existent that they can't access a bus stop. When it comes to communication, there was a lot of talk of modernizing the various rideshare services, whether it be Metro, Mobi, whether it be a community providing paratransit, being able to just track where the vehicle is, a little more live time. Languages, that was, as Alicia said, that was a big thing for people, especially with refugee populations. How does someone who doesn't speak English or Spanish access these services? And then third-party surveying, it was recommended that both MAPA and Metro have a third-party kind of survey riders every once in a while just to kind of gain feedback. And I think that'd be a really neat thing to do during the coordinated transit plan process. Coordination, coordinating with medical providers, obviously chambers of commerce, things like that, to really pick up the employment aspect. So how do we get people who cannot drive to places of employment so they can at least have that little bit of independence? So they can, maintain employment. Dynamic scheduling, that was probably the most interesting and probably the most thought-provoking in my subgroup of this event. Working with medical providers to figure out how to get a patient who might be 15 minutes late to appointment, but not at their own fault, but because a transit trip was late. How can we maybe make it so that their appointment time is between 10 and 10:50 instead of just at 10:20? I thought that was really interesting. It could be a conversation we try to foster in the future. I know we talked with our during our debrief with the National Center for Disabilities and Transportation. We did mention that, stating that a lot of these mega corporations are huge for hospitals and clinics. That might be more of a national conversation, but we're going to try to have that conversation locally. But we've also kind of risen that to the national level. They were really receptive to it. Education, and it comes down to educating potential riders how to use it, and educating drivers of how to handle persons with specific impairments or disabilities, just to make sure that it's as seamless and as comfortable and even enjoyable experience as possible. And then there's the last one, funding. I think that's the one that all of us worry about the most. We all have to work within the financial realms that we're in, so exploring more funding and how we can maybe leverage partnerships and stuff like that. And then also what possibilities are there for free fares, especially for particular services for people who just can't afford what's out there at the moment, especially with rideshare service and stuff like that. I mean, there are people who spend $50 a day getting to an appointment using those. And so I was actually quite intrigued when, Steve with United Way just now was talking about their free lift program. So I think that that fills a lot of gaps that just aren't filled right now in the region, so.
So some of our next steps include debriefing with you all, so that's what we're doing today. And then other committees as well that we wanted to kind of continue engaging and partnering with as we go through those solutions to the barriers. We're hoping to continue the conversation, so not having it just be a one-time symposium, but maybe looking to repeat it and expand it as well to be able to engage more communities and more voices. Continuing the partnership between MAPA and Metro, along with other folks, and then exploring that additional survey work, and at least coordinating the data that we do have.
That being said, whether you were at the event or you weren't, I'm just curious, if you guys have any things to add? One thing I will ask, and I'll send out an email after this, I will send out this matrix that I provided for you. We might use this kind of as a guiding document moving forward. It can kind of maybe identify some priorities as to maybe things that this committee can tackle in the future. So, you know, it was a fantastic event. We couldn't be happier with how it turned out. So we're really appreciative of everyone who participated. So. Okay.
Thank you.
So I guess I'll just stay up here. This will be fairly quick. And for those of you who don't know him, Charlie Harrington is our communications intern. So what I've tasked him the last month or two with is creating a mobility resource guide for the Omaha Council Bluffs region. I'll provide you guys all with a copy of it. And I was just going to kind of go through it. As you guys can see, we have quite a few of the various providers, including everyone on this committee. Does everyone have a copy of this? So basically, we've provided a lot of information here related to the services you provide, the type of services, who's eligible, stuff like that, as well as some other services like additional information. And on the back, some frequently asked questions, including some 211 information. So what I'm asking for is some feedback on this. As you can see on the back, it says draft in really big letters. We're not quite done with this. We really want your feedback first, and this is something that we want to continually update as a committee moving forward, just as a service that MAPA provides, because there's a lot of stuff, like I said, that people don't know about. So obviously, this is one more way to provide that, you know, piece of literature that can be found online or in a bus or at a resource center or something like that. Is there any comments? Or I can also send out like a survey link if you guys want to like actually look at somewhere and provide some feedback.
Very nice.
So,
Thank you.
okay. Well, I think that's all we had. Well, yeah, here's the, I guess I missed that, but do we have any other additional business from the floor or any public comment?
We do have some Omaha drivers that went to the state rodeo. And they actually, two of the drivers made it to nationals. So they'll be going to Palm Beach, Florida in June. So my driver, Mindy, made nationals. She placed first. And then
Yeah, Joe Walker placed second. Also going to the nationals.
kind of exciting that two Omaha drivers will be attending the national rodeo.
From a user's perspective, that was great. So, you know, it's good to hear.
Anything else? Well, just a few calendar updates. Our TTAC board, of which we're a subcommittee of, meets Friday, October 20th at 10 a.m. The MAPA board, October 26th. Something we haven't really talked about in the CTC is the surface transportation block grant TAP call for projects. Those are open both in the MPO region, which is the metro area, and the RPA region, which is rural Iowa, kind of surrounding on the eastern side of the metro. Especially on the TAP side, which is Transportation Alternatives Program, there is some funding available for. Certain transit projects, so it's something to keep an eye out for. MAPA will be releasing a lot of information related to that program, very soon, so you can keep an eye out for that. And then, I think this has been announced before, but we're not gonna do a 5310 call for projects this year, as we discussed in previous meetings. So. That being said,
That calls our meeting to an end. Is everybody okay with that? Can we get a motion to end it, or does everybody want to stick around a little longer?
we have a motion,
I will mention it.
second,
Um,
all in favor? Any opposed? Meeting is adjourned.
If I was you guys, I would go out this door here, I go out the next door because they're doing, interview trying to set.